Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the last previous session, we have discussed the very important questions, concept, and the regimens, and the very important schedules that is necessary for our exam purpose. So again, I am in this today's session trying to revise your golden points, and I am trying to revise your very important points before going to the exam. Okay, just a glance we will have, and wherever the concept is necessary, I will explain that one in perfect, in short, that is necessary for your exam, right? So wherever I am telling it is important, please pay the special attention because it is very important for your exams, right? Yes. So a very good evening, beta. Very good evening to one and all who are attending the class live. So fatapat hit the like button. And if anyone of you are new to the Master Nursing classes, please do subscribe to the channel. If possible, please keep this particular video in your WhatsApp status, so it will help us to reach the more nursing students, right? So because our channel is professional, right? So the general people won't watch this one, right? Only it is helpful for the nursing aspirants. So you are the brand ambassadors, so you can promote our channels by keeping in your WhatsApp status and by sharing in our college groups and all. Okay. Yes. So yes. Very good evening to one and all. Very good evening. Yes, we will. Can we start the session? I hope the video, audio, everything is clear to every one of you. Yes, without any delay. So we will start the session now with this powerful motivational line. Dear students, this is the time to be a very positive and think very positive. Okay, so whatever the efforts you have made, whatever the dedication you have given, whatever the sacrifices you have made since last 1 year or the 2 year, that is going to pay you in the next 3 to 4 days. Yes, so that is going to help you in the exam definitely. Just think positive and be positive, stay positive, and say some words positively to your friends, motivate your friends, okay, and keep the healthy environment around you. Okay, if anything is not clear to you, just discuss with your friend. Okay, text me in the WhatsApp also, right? So yes, for that you can join our WhatsApp group, and you can use our app for clearing your doubts. Okay, in the chat box you can clear your doubts. Okay, so but just try to be positive and try to think positive. Everything will be positive, and your result will also comes positive way. Okay, yes, definitely. So with this powerful motivational line, we will start the today's session, and I hope the sound is video. Video is everything is clear. Yes, fatapat do thumbs up. A very good evening to one and all. Good evening, beta. Good evening. Without doing any delay, we will start the session now. Okay, here is the first question which is coming in front of you. So please try to read the question carefully, completely, then try to give the best answer. Yes, which of the following is not covered under the NVBDCP? What is the NVBDCP, sir? What is the NVBDCP, sir? NVBDCP is the very simple thing. We call this one as the National Vector-Borne Disease Control Program. Okay, what is this one? This is the national program where we are controlling the diseases which will spread by our vectors. Okay, so that is the National Vector-Borne Disease Control Program is the NVBDCP. So in this one we have the various disorders which will comes under the NVBDCP. Okay, sir, how to remember the disorder, sir? Please try to remember this mnemonic. That is the MD means Muhammad. We can write, right? So Ajar, Muhammad Ajar likes chicken G. Okay, so you can remember like this. Okay, M stands here is the malaria. D stands here is the dengue. Ajar stands here is the Kala Ajar. And like stands here is the lymphatic filariasis. Or you can say elephantiasis also for this one, right? Chikungunya. Chicken stands here is the chikungunya. J stands here the Japanese encephalitis. Okay, so very important. Remember the mnemonic, that is the Muhammad MD. Okay, Aja likes chicken G. So these are the disease conditions which will be comes under the NBBDCP, right? So among all these disease, this malaria vector will be the mosquito. Dengue also have spread by the vector called mosquito. Okay, but only one disorder which comes under the NVBDCP is spread by the sand fly or the fly. You can say that is the our kala ajar. Rest all the like disorders which are there in the NVBDCP are spread by the mosquito. Okay, look at this one. Here the vector is mosquito. Here the mosquito. Here the mosquito. 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 But only one disease which is spreading by a vector called as the sand fly. So that is our kala ajar. So you have to remember this one for your exam. Under the NVBDCP, which disorder is not spread by the mosquito? Okay, so this is the kala ajar is not spread by the mosquito. It will spread by the our sand fly. So very important question and the concept for your exam, right? So and examiner also very much interested to ask the question on, yes, the vector names in the exam, right? So yes, the malaria causative agent will be the plasmodium agents. Okay, that is the plasmodium falciparum, plasmodium vivax, plasmodium ovale, and plasmodium malariae are the different type of the plasmodial agents. So those all are the causative agents, right? So vector will be the our female Anopheles mosquito. Okay, so not Anopheles just Anopheles mosquito. It is in the female Anopheles mosquito. Very, very important. Keep in your mind. This will be your exam golden point. Okay, this will be your exam golden point. Very, very important for your exam. Okay, so keep in your mind. Then comes to the dengue. Okay, dengue, the causative agents will be the den viruses or the dengue viruses, we can say, which is a comes under the family of the flavivirus. Okay, so here very, very importantly, the agent, sorry, the vector will be the Aedes aegypti mosquito. Better how to remember, dengue D is there and here Aedes is there. Okay, so you can remember. Okay, so also DE you can remember, and here the written DE. Okay, so that's the dengue, how you can remember. So dengue will be spread by the Aedes aegypti mosquito. Okay, so Aedes aegypti mosquito is the a causative vector for the not organism. It is in the causative vector for the our dengue disease. Okay, next comes to the chikungunya. So for the chikungunya, again Aedes aegypti mosquito is the primary answer. Okay, which will cause by the chikungunya viruses, which is the family of the alphavirus. Okay, so very important. Then comes to the lymphatic filariasis, or we can say the elephantiasis, which is having the causative organism of the Euchelaria bronchopti or the Burgai malai. So here the main answer goes to the Euchelaria bronchopti. So this is the multiple time asked question in your exam. So very, very important for your exam. Okay, so what is the causative agent for the lymphatic filariasis? The causative organism for the lymphatic filariasis is the Euchelaria bronchopti, and the vector which is responsible for the filariasis is the Culex mosquito. Very important. Keep in your mind, right? Okay. Next comes to the kala ajar. I told kala ajar will be spread by the sand fly. Okay, so we call this one the causative organism for this one is the Leishmania donovani. Okay, so Leishmania donovani is the causative organism for the kala ajar. Okay, so very, very important, which will be caused like spread by the vector called as the sand fly, and only disease which is spreading by the fly in the NVBDCP is the sand fly. Very important. Okay, so the next is the Japanese encephalitis. Okay, which will be caused by the Japanese encephalitis virus and which is spread by the Culex mosquito. Very important. Among these chart, one question is having the highest chance of asking in your exam. Okay, so in this there is one question is fixed in your exam, right? Very important. Keep in your mind, right? So this is the mnemonics. What are the disorders will comes under the NVBDCP? Yes, according to the our mnemonics, malaria is a part of the NVBDCP, dengue is a part of the NVBDCP, kala ajar is a part of the NVBDCP, but tuberculosis is not a part of the NVBDCP. Okay, so this is a comes under the program called as the National Tuberculosis Elimination Program. Okay, so there is the NTEP is the program where the tuberculosis we will discuss in that particular program. It is not discussed under the NVBDCP. Hope it is clear to every one of you, right? So here is the next question. Yes, 99.99% of you have given the correct answer for the last question. I am very proud of you Be active, attentive in the comment box, involved in the session, and try to understand the concept what I am teaching to you people. And wherever I am telling, it is the differentiating part. Okay, so like in the last chart, I have told to you people that okay, one disease which will not caused by the mosquito, that is the kala ajar. Okay, so like this golden points will come, so you can grasp that one. It will be helpful for your exam. Okay, so the next question is here. Yes, which of the following is a sign of the good attachment during the breastfeeding? The 1,000 star important question. Okay, not only first star, second star, it is on the 1,000 star important question for your exam. So try to read all the options properly, perfectly, then give the best answer. Yes. Which of the following is a sign of good attachment during the breastfeeding? So we have the sign of the good position and the sign of the good attachment. Means the sign of the good attachment stands here is the how well baby is attached to the breast of the mother. Okay, how properly the baby is able to suck the breast of the mother. So there are some signs are there. So if the baby is holding the mother breast in that particular sign, means we call it as the good attachment, right? If the baby is not showing that signs, means the attachment is not good. Okay, yes. So what are the sign of the good attachment? Okay, which of the following is a sign of the good attachment during the breastfeeding? Option A is telling a baby is a baby's chin is away from the breast. The baby's chin is away from the breast. No, beta, baby's chin should be not, it should not be away from the breast. Okay, it should be towards the breast. Okay, it is attached to the breast. Okay, so very important. It is not away from the breast. So I am eliminating the option A. Then option B, baby's mouth is barely open. No, baby's mouth should be wide open. Beta, it not barely open. It should be wide open. Right. So I am eliminating the option B also. Right. Option C is the more areola is visible above the baby's mouth than the below. Yes, this is the correct. So areola should be visible more visible in the baby's mouth. Okay, so it will be more areola is visible above, not the below. Okay, so below one is completely covered. Okay, above one should be more visible. Okay, so that is the very important. Baby's lip should be pursed inward. No, baby's lip should be pursed outward, not inward. Important. So let me quickly revise all the golden points on the sign of the good attachment. Look at this one. Okay, so sign of the good attachment, it is your exams very important concept, beta. Okay, so please do remember futures. Look at this one. Mouth should be wide open. Okay, I told the mouth should be wide open. Very important, right? So the next one, chin should touch to the breast. Chin should be away from the breast. It should be touching towards the breast. Okay, it should be touching to the breast. Very important. Then lower lip should be everted out like this. It should be turned out like this. Okay, so that is the very important. Keep in your mind. It should not turn inwarded. Okay, it should be always outward. Okay, so then the areola visibility, more areola visible above the baby's mouth. Okay, so then the more visible above the baby's upper lip than the below. Okay, so that is the very important, right? Then the suckling. In the suckling, the baby should suck deep and slowly, perfectly. Okay, with pause should be there. Okay, suck, then pause, suck and pause like this. Not quick and shallow. Quick and shallow sucking is not a sign of the good attachment. Deep and slow sucking with pause is the good sign of the attachment. Very important. Keep in your mind. Okay, so this is your very important for your exam. Right, here is the next question. Sorry, understand about the sign of the good positioning also. Okay, when the baby holds the baby, when the mother holds the baby, so that time how she should hold for the proper breastfeeding. So this will be your exam's perfect and the very perfect question. Repeatedly asked question. Okay, baby's head and body should be straight in line. Okay, so head, buttock, okay, and the neck should be in the straight line. It should not be like bended like this. Okay, when she will hold like this, okay, it should be straight line, right? And the baby should held close to the mother body like this. She should not hold like this, right? So mother should hold the baby like this, close to the body. Okay, that it is called as the good positioning, right? The baby's face should be turned towards the breast of the mother. It should not be turned away from the breast of the mother, right? So face is this side, means how the baby will feed? It's impossible, right? So baby's face should be turned towards the breast of the mother. Okay, so then the mother should support the baby's whole body. Okay, not only just head and neck. She's holding the head and neck, and the whole body is hanging. So that is also not good sign of the position. She should support whole body. Okay, including the head and neck. Right. So this is the very important signs of the good positioning. Right, and the baby mother's abdomen and the baby abdomen should be touched. Okay, it should be touched. Okay, so then only the baby will be turned towards the breast of the mother. Okay, so that's the very important signs of the good positioning you have to keep in your mind. Right, so baby's head should be baby's body should be complete, head and body should be completely straight line. A baby should be held close to the mother body, and the baby's face should face towards the breast of the mother with the nose opposite to the nipple. Okay, so then mother should support the baby's whole body, not only just supporting the head and neck. Okay, she should support the whole body. So this is the sign of the good positioning. This is also your very important concept for your exam. So the examiner are very much interested to ask the question on this one. Okay, so please keep in your mind. Right. So here's the next question. Okay, already in the yesterday's class, according to the MAP program, we have discussed the like how and when we need to initiate the breastfeeding. Okay, so here in this the WHO guidelines, what it will say actually, according to the WHO guidelines, when should breastfeeding be initiated after a birth of normal delivery. Okay, so what happened here, according to the World Health Organization, so when should breastfeeding be initiated after birth of a normal delivery? So normal vaginal delivery have been happened in yesterday's class only. I told you people breastfeeding. Okay, so that is a very important one, right? So in a normal vaginal delivery, that is within 1 hour we need to start or as soon as possible. Okay, so within 1 hour means it should be immediately after the birth. It should be within 2 minutes. It should be within 5 minutes. It should be within 30 minutes. Means we should not go behind the 1 hour. Okay, within 1 hour we will start the breastfeeding. Okay, so the option A is telling within 6 hours. No. Option B is after the 24 hours. No. Option C within the 4 hours. No. So in the normal vaginal delivery, as soon as possible goes to the correct answer. Okay. So if this one is not there in the option, within 1 hour goes to the correct answer. Right. So both are there in the option. Within 1 hour goes to the correct answer. Okay. So very important. Keep in your mind. And as soon as possible and within 1 hour will not come in your exam. If it is coming, so you can choose answer anything. Okay, so especially the best answer is the as soon as possible. Okay, so we should not wait till the 1 year also. Sorry, 1 hour also. Okay, so that is the as soon as possible. So within 1 hour and as soon as possible are the both correct answer, right? So the next, in case of the lower segment cesarean section, I told yesterday's class only we have discussed. So I told these are the 4 words, and we will start the breastfeeding within 4 hours. Okay, so here there is no any confusion. Hope it is clear. Right, it should be started within 4 hours. Right, hope it is clear to every one of you. Right, so the next question is here. According to the baby friendly hospital initiative, which of the following is encouraged immediately after the birth? According to the BFHI, so which one we will encourage immediately after the birth? Can we encourage for giving the formula feeding immediately after the birth? Never ever encourage for the formula feeding. Okay, for first 6 months. There should not be given anything for the first 6 months. Only exclusive breastfeeding should be given. Then option B, delayed bathing. It is the not in work done under the BFHI. So first and foremost thing, immediately we should encourage to the newborn or the after birth immediate work should be skin to skin contact to prevent the hypothermia, and the early breastfeeding promotion goes to the correct answer. So the main work of the baby friendly hospital initiative. So whatever the BFHI is there, the main work of this one is the promoting of the breastfeeding. The main work of the BFHI is the promoting breastfeeding. So this is the correct always primary work of the our baby friendly hospital initiative. Very important question. Okay, so then let's have the glance and the rapid version of the BFHI. So full form of the BFHI is the baby friendly hospital initiative. Okay, so here the baby friendly hospital initiative was started by the World Health Organization and UNICEF both. Okay, and the main purpose I told for the promotion of the breastfeeding. Okay, so the next question is here in front of you. So 14 principles theory of the like who proposed the 14 principles theory of management? Yes, tell me the important question. In your management, there is one scientist who proposed the 14 principle theory. If any one institute, if it is following the those 14 principle, the growth of the institute will be very well. So yes, the 14 principle theories which will be given by the whom? Yes, that is given by the Henry Poyles. You can remember Poyles 14. Okay, so that is the F Poyles and the F 14. Okay, 14 principle theory will be given by the Henry Poyles. Okay, so the very important for your exam. And here is the next question. Yes, almost all you people given the correct answer. The next question is here in front of you. How many primary teeth are present? Just give me a minute. How many primary teeth are present in a complete set of the baby's teeth? Students, the question is regarding primary teeth. Don't go for the total number of the teeth. Okay, how many primary teeth? So this primary teeth we also call this one as in the deciduous teeth. Decidual teeth. Why we will call this one as the decidual teeth? So decidual teeth means anything which is shed out from our body, which will gone out of the body. So that is what we call the decidua. Okay, or the decidual teeth. Okay, so endometrium of the pregnancy we will call the decidua, right? So that endometrium it will get shed out after the pregnancy. Then only that endometrium we are calling the decidual. Okay, yes, the decidual teeth means here the teeth which will falls up. Okay, so yes, ಹಲ್ ಬಿದ್ದದ ಅಂತಾರೆ ನೋಡ್ರಿ. Okay, so ಬೀಳುವಂತ ಹಲ್ಲುಗಳು ಇವೆಲ್ಲ, right? The primary teeth we also call as the decidual teeth, and we also call this one as the temporary teeth, which all are not permanent teeth. So these are the temporary teeth. Okay, so very important. The total number of the temporary teeth or the decidual teeth or the primary teeth is the, yes, that is the 20. So almost all 99.9% of you have given the correct answer. Total number of the primary teeth or the decidual teeth or the temporary teeth are the 20. Sir, how these are the 20? Which one is the first? Which one is the last? Okay, which one is the first temporary teeth? Which one is the first permanent teeth? So these are the questions which may having the highest chance of and striking in your exam. Let's quickly revise all the key components of the our eruption of the teeth. Okay, so that is very important. I will discuss on the primary teeth first. So this primary teeth we also known as this one is in the decidual teeth I told, or the temporary teeth I told, or milk teeth also we will call this one. Okay, yes. So if this primary teeth it will erupt at the 6th month of the life. Okay, it should erupt at the 6th month of the life. If in case it is present since from the birth, it is present since from the birth. Okay, when the baby will born, when we will check the oral cavity, there should be no any teeth. Okay, so it will start erupt after the 6th month or at the 6th month, right? So if in case by mistakenly when we will open this, just the newborn have been born and we have opened the mouth of the newborn, inside the mouth there's teeth is there. Okay, so primary teeth are the temporary teeth which is present since from the birth. We call this one as the natal teeth. We call that one as the natal teeth. Very important. Okay, so means the teeth which is came from the birth, we call that one as the natal teeth. Okay, so the next very important thing, formula of the primary teeth beta. So we have the mouth like this, we have the mouth like this. Okay, so in the mouth we have the teeth which is there above and the below, right? So here it is divided into the 4 quadrant, right? So now I will write the formula like this. Okay, so here the teeth which will comes here are the incisors. Okay, so these are the incisors, and after the incisors there are the canines. Okay, so after the canines there are the premolars, after the premolars there are the molars, and similarly this side incisors, canines, premolars, molars. Similarly downside. Okay, so here the incisors, sorry, middle incisors, canines, premolars, molars. Incisors, canines, premolars, molars, like this. So how many total incisors will be there? So these teeth which are there in the middle, so those are called as the incisors. Okay, so just I will write how many incisors are there, how many canines are there, how many premolars are there, and how many molars are there. But a total incisors we have is the 2120 is your formula. Okay, so means here we have the two integers, means this side it will be 2, down it will be 2, and here it will be 2. Totally how many integers we have? Total integers will be 8 integers. Okay, so here we have the like formula of the premolars, canines up 1 means down 1, 2, and this side 1, here 1. Okay, so total how many? 1 2 3 4, total 4 canines we have. Okay, so very important. Then comes to the premolars. How much we have? The premolars we have here is the 0. Okay, so premolars we have here is the 0. Sorry, this is the 2102, not like this. This is the 2102. Okay, so premolars 0. There is no any premolar teeth in the temporary teeth, and just we have the molar teeth. Okay, so molar teeth again. So here 2, up to, down to, and here up to, down to. Okay, so this is again 8. Okay, so 8 molar teeth, 8 incisors, and the 4 canines we have. So total how much? Total is the 20. Okay, temporary teeth we can say. Okay, very important, keep in your mind. Okay, so the formula is the 2 1, it is not 2 1, it is 2102. Okay, so that's the very important incisors, canines, premolars, molars. Okay, so we don't have the any premolars, okay, in the newborns. Very important, keep in your mind. Okay, so total 5 teeth are 5 teeth per quadrant, so 4 quadrants will be there. So like in the one quadrant there are the 5 teeth. Okay, so there is the 2 incisors, 1 premolar, and the 2 incisors, 1 canines, and the 2 molars. Okay, so there is no any premolar. Okay, so total in one quadrant 5 teeth. Okay, so total 4 quadrants are there, total 20 teeth will be there. Okay, so we can say, or individually also question will come. Total number of the incisors, we have. Total number of the incisors we have the 8, and the total number of the canines we have the 4, and the total number of the molars in the temporal teeth we have the 8. Okay, so total will be the 20 teeth. Okay, 20 temporary teeth. These all teeth will erupt out. Okay, sorry, it will shed out. Okay, so that is the very important, keep in your mind. Okay, so here is the next question. Yes, at what age do the first permanent teeth typically begins to erupt? Okay, so when you will see the first permanent teeth? Yes, at the what age do the first permanent teeth typically start to produce, or the start to begins to erupt? Both are the same. First permanent teeth will be seen at the year of the 3 years, 6 years, 9 years, or the 12 years. When it will be seen? At the what age does the first permanent teeth typically begins to erupt? At the age of the 6th year, the first permanent teeth will be start to begins. Okay, so remember, at the 6th month, temporary teeth start to erupt. At the 6th year, permanent teeth will start to erupt. Very important, keep in your mind. Okay, so 6 month is for the temporary teeth to start to produce, and the 6th year is the permanent teeth to start to produce. Okay, so very important, keep in your mind. Okay, so let's come to the golden point revision on the permanent teeth beta. So this is the permanent teeth formula how we have here. So that is the total 32 permanent teeth are there. Okay, similarly I told, so this is the mouth. Okay, so this mouth we have divided into 4 quadrants. Okay, so we have divided into the 4 quadrants, and in each quadrant there are the 2 incisors. Okay, after the incisors there is 1 canine, and the 2 premolars, and the 3 molars. Okay, so that is the very important 2 1 2 3. Okay, so total how many in the one quadrant? In the one quadrant, so that is the 3, 3, 6 plus 8. So, okay, total how many? Total 8 teeth will be there in one quadrant. Okay, in one quadrant how many teeth? It will be 8 teeth. Okay, so means here 8 teeth, here 8 teeth, here 8 teeth. Total permanent teeth it will be 32 teeth will be there. Okay, very important, keep in your mind, right? So this is the very important and very easy question. There is examiner having the highest chance to asking in your exam. Okay, so total incisors again 8, total premolar, total canines 4, total premolars 4, total molars is 6, sorry, total molars is 12. Okay, so that's the very important, right? So here the 3 means here it will be 3, right? Here it will be 3, here it will be 3. So 3, 3, 6, 3, 3, 6. Total is the 12 molar teeth we are having. Okay, so in the permanent teeth, which one is first to form? Okay, so that's the first understand. Okay, types of the teeth I am talking about, the now primary teeth or the temporary teeth. So it will start to produce at the 6th month of the age, and it will be around the two, like eruption will be there, and at the 2 to 3 years of the age the eruption will stop. Okay, so in the permanent teeth. Okay, so typically it will be 6 months to the 3 year will be the age duration of the like primary teeth. Okay, or the temporary teeth. Here in the permanent teeth, here in the permanent teeth it will start produce by the 6 years. Okay, and it will like produce till the 25 years. Okay, so typically age duration will be the 25 years for the stopping of the eruption of the permanent teeth. Okay, so this is the important one, and understand this one and try to give the correct answer for this particular question. This is your very important question. Yes, a 7-month-old infant is brought to the clinic by his parents. So what happened? The 7-month-old infant is brought to the clinic by his parents. They are concerned about the baby's teething. On examination, the dentist find the eruption of the first primary teeth. So which tooth is most likely have erupted here? So the simple question is, which is the first primary teeth to erupt, or the which of the following is the teeth first it will produce? Okay, so first primary teeth will be erupt. Okay, so first primary tooth, which tooth will be most likely to be erupted here? Okay, so here the very important, just it is the a baby of the 7-month-old. Okay, so which came to the hospital, and the parents are worried. Okay, my baby is 6 month completed, still there is no teeth better. So there is the only teeth is there, only one, like 2 teeth are there, 4 teeth are there, like this the parents are complaining. Okay, and dentist visualize the examine, like he seen the oral cavity of the body, and like in this one the dentist find there is the eruption of the first primary teeth. Okay, which is the first primary teeth is your question. So option A, upper canines. Option B, lower central incisors. Option C, upper second molars, and option D, lower second molar. So what is the first temporary teeth, or what is the first primary teeth? What is the first milk teeth? What is the first decidual teeth to get erupt? Yes, the first decidual teeth, primary teeth will be the lower central incisors. That's the LCI is the lower central incisors, is always first eruption of the teeth. Okay, so this down teeth are the always first erupted teeth. Okay, so please keep in your mind. Okay, and here will be the very important first and second teeth will be there, so please keep in your mind. So this one. Okay, so this is about the primary teeth. Okay, this is about the permanent teeth. Okay, so very important for your exam. Primary teeth or the temporary teeth, and here is the permanent teeth. Okay, so in the primary teeth or the temporary teeth, the lower central incisors, primary teeth or the temporary teeth, lower central incisors are usually erupted first. Okay, so the first teeth it will erupt in the like deciduous teeth will be the always lower central incisors will be erupt first. Okay, the second molars are the erupt. Okay, last primary teeth to get erupt. Okay, so which one is the last permanent teeth? Last temporary teeth to get to erupt. That is the second molars. Okay, so very important. And in the primary teeth or in the temporary teeth, there is no premolars. Please remember, there is no premolar teeth. Which teeth will be not available in the primary teeth? So that is the premolar teeth will be not available in the primary teeth. Okay, so very important. First primary teeth to produce is the our lower central incisor. Last primary teeth to produce is the second molars are the last primary teeth to produce. Okay, very important. Keep in your mind. Okay, so the next one is the comes about the matter of the permanent teeth. In the permanent teeth, the first teeth to produce is the first permanent teeth to produce is the that is our first molar or the first permanent teeth. Okay, so very important. First molars are usually the first permanent teeth which will get erupt. Okay, so that's the very important. So which is the first teeth it will produce permanently, that is the first molar. Okay, so then the third molars are the we call this one as the wisdom teeth. ಈ ಹಲ್ಲು ಬಂದ್ರೆ ಬುದ್ಧಿ ಬಂದವ ಅಂತ ಹೇಳ್ತಾರೆ ನೋಡ್ರಿ ನಿಮಗೆ. ಓಕೆ, ಸೊ ದವಡೆ ಹಲ್ಲು ಅಂತ ಹೇಳ್ತೀವಿ ಕನ್ನಡದಲ್ಲಿ. ಸೊ ಇನ್ ಕನ್ನಡ ವಿ ಯೂಸ್ ಟು ಕಾಲ್ ದಿಸ್ ಒನ್ as the ದವಡೆ ಹಲ್ಲು. ಸೊ when this wisdom teeth will come, so that it will be like men or the woman or got matured, like they will consider, right? So mentally matured. Okay, so like this, right? So the third molar teeth are these are the last erupt permanent teeth. Okay, so it will be produced at the year of the 22 to 25 years of the life it will produce. Okay, so very important. Keep in your mind, right? So these are the important and the very important one liners there may be having the highest chance of asking in your exam. So be aware of these questions. Okay, here's the next question. A football player suddenly twists his ankle during the game and he feels immediate pain with swelling around the joint. So what happened? This is the scenario based question in front of you all. So a football player is there, suddenly he's twisted the ankle is there and immediately pain is there and the swelling is there around the joint. On the examination there is no tenderness over the ligaments. Sorry, on the examination there is tenderness over the ligament but no muscle involvement. What is the most likely diagnosis? Better, there are the two words you have to understand. One is the strain, another one is the pain. Sprain. Okay, so what is the strain? What is the sprain? I will teach you with how to identify and grasp that one very easily. Keep in your mind. Okay, so remember, if there is any injury to the tendon, if there is any injury to the tendon, we call this one as in the strain. Okay, so that is injury to the tendon is the strain. Very important. Keep in your mind, right? Now here also T is there, here also T is there. There is the injury to the tendon is the strain. Injury to the ligament, we call this one as in the sprain. What we call this one as in the sprain. Okay, so here also no T, here also no T. Remember, right? Whenever there is an injury to the tendon, we call it one as the strain. Injury to the ligament, we call this one as the sprain. Okay, so here what happened? There is tenderness over the ligament but no muscle involvement, means the muscle ligaments have been damaged here. Okay, so this is the ligament, means what is your likely diagnosis? The diagnosis is the ligament is damaged. Ligament damage means the sprain will be the answer. Okay, so search for the sprain where it is in the option A strain, option B sprain. Okay, so sprain goes to the correct answer. Hope it is clear to every one of you. Yes, so what is the bone fracture? Bone fracture is the break in the continuity of the bone is called as the bone fracture. Okay, so tendonitis is the infection and inflammation of the tendons, we call that as the tendonitis. Okay, so here is the next question. Understand the question, analyze the question and give the best answer. Yes, again a patient twisted their wrist. The wrist is twisted during the fall. Okay, so during the fall the wrist is twisted and there is pain, there is swelling and there is difficulty in moving the wrist. So what are the things are there? The patient is having the pain, swelling and difficulty in moving the wrist. Okay, but x-ray shows no fracture. So what the x-ray showing here? The x-ray showing there is no fracture, right? So what is the initial management is appropriate? Which initial management is appropriate? Yes, there is no fracture, only there is the difficulty in moving the wrist and there is pain is there. Yes, and the patient is having the history of the twisted wrist. Okay, so patient twisted their wrist during the fall and there is pain, swelling and difficulty in moving the wrist, but there is no any fracture. What is the initial management of this particular situation? Yes. So we will go for the rise approach. Okay. So it may be due to the injury to the ligament, or it may be due to the injury to the our tendon. Okay. So there, in that particular situation, the first aid management we have to go for is the rise. Okay. So what is the rise? So rise is the, remember this particular very important mnemonic. So R stands here is the rest, and I stands here is the ice. C stands here is the compression. Then E stands here as the elevation. Students, first we need to rest the injured part. Means immobile the injured part is always priority, because you are moving the injured part. You are checking that wrist is twisting or not, wrist is moving or not. So you are again moving, means it will further damages the ligament. It will further damages the tendon. Okay, so very important. Keep in your mind, right? So it will further damage the ligament and the tendon, right? So then the I stands here is the ice. Okay, so that is the, at the injured site we will apply the ice. Okay, so ice application we will do at the injured site. So where there is in the ice application, if we are applying, means so it will constrict the blood vessels. It constrict the blood vessel means it will reduce the bleeding, and along with that it will reduce the swelling at the site of the injury. Okay, so that's the reason we will do the ice application, and we will maintain the compression over that one, and we will maintain the pressure over that one. Okay, so this pressure which will reduce the swelling. Okay, it will decrease the swelling. Okay, it will immobile, reduces the, decreases further damage, decreases the further damage. Okay, so then the ice application decreases the blood supply and decreases the further swelling. Okay, elevation, it is decreases the edema. If we are keeping above the heart level, so the drainage will be goes back. Okay, so it will not accumulate, there is no any accumulation of the fluid, so there is no any edema. Okay, so these are the a very important strategy in case of the strain and sprain we will follow here. Okay, that is the right strategy, or the as a first aid strategy for the injured person. Okay, first aid strategy for the injured person, very important, keep in your mind. Okay, so the next very important thing, whenever we will do this one, so first aid treatment protocol used in case of the reduced pain and swelling, sorry, to reduce the pain and swelling, we will do this one to prevent the further injury, and we will do this one for the of promoting the faster recovery. Okay, so this is the very important one what you have to keep in your mind. Okay, so the next question is here in front of you all, so please do read the question carefully, completely, then try to give the best answer in the comment box. What is the goniometer primarily used to measure? What is the goniometer primarily we are using to measure that one? Yes, option is there in front of you. What is the goniometer we are using to, sorry, what is the goniometer primarily we are using to measure? So beta, blood pressure will be measured by the which instrument? That is the sphygmomanometer. Here you notice the word manometer. Wherever the word manometer it will comes, we are using this one to measure the pressure. We are using this one to measure the pressure. Okay, so that is the, we are measuring the blood pressure. We are using the sphygmomanometer. Okay, so that is the very important. And muscle strength will be measured by the muscle strength grading scale. Okay, which is like we are asked the patient to like raise the leg or the raise the hand. Okay, against the gravity, with the gravity, against the pressure. Okay, so that is the muscle strength test we will do. There the goniometer is not used. So this goniometer is the scale we are using to check the range of motion ability of the particular joint. Okay, so consider, so the patient have the particular suturing here. Okay, so after 3 months he came to the OPD and he is unable to extend his arm completely, and he is unable to flex the arm completely because these sutures which have been created, the adhesions here, so unable to extend and move the hand properly. So that time the range of motion of this hand is reduced. So in order to measure the range of motion of the particular joints, we are using the goniometer. Okay, so the goniometer is the instrument we are using to check the range of motion of the particular body part. Okay, so that's the very important. And to measure the body temperature, every one of you know that is the, we are using the thermometers. Okay, very important, very simple. And here's the next question. At what age does the anterior fontanelle normally closes? And after this, you will get one assignment question also. Okay. So try to give the answer for this question. At what age does the anterior fontanelle normally closes? Option A, 6 week. Option B, 6 month. Option C, 16 to 18 months. Option D, 20 or 4 to the 30 months. Beta, if someone is asking the question regarding the closure time of the anterior fontanelle, so anterior fontanelle will closes at the duration of the, yes, 16 to 18 months. So almost 99.9% of you given the correct answer. During the 16 to 18 months, anterior fontanelle will closes. And during the 6 to 8 weeks, posterior fontanelle closes. Both are important question for your exams. Okay, so very important, keep in your mind. Okay, so at the 6 weeks to the 8 weeks, which fontanelle closes? That is the posterior fontanelle will closes at the 6 weeks to the 8 weeks. This is the examiner favorite question. Okay, so this is the examiner favorite question. When the anterior fontanelle will closes, posterior fontanelle will closes. Okay, so posterior fontanelle will closes at the time duration of the 6 to 8 weeks, and the anterior fontanelle will closes at the time duration of the 16 to 18 months. In the question, what they have asked? They have asked related to the anterior fontanelle closing time. So anterior fontanelle closing time is the 16 to 18 months. Okay, so this is the correct answer. Please keep in your mind. So this is your very important question for your exam. Okay, so the next question is here in front of you. Like, what is this particular case? A 10-day-old healthy full-term newborn presents with a multiple small white, that is the 1 to 2 mm size mark on the nose, cheeks and the forehead. Okay, so there is in the multiple means not one or two. There are the many small white marks are there on the nose, cheeks and the forehead. The infant is feeding well and shows no sign of the systemic illness. Okay, there is no any systemic illness problem is there. There is no pus, no redness, no inflammation, nothing is there. So what is the most likely diagnosis? Yes, option A, neonatal acne. Option B, melia. Option C, erythema toxicum neonatum, and option D, impetigo. So simply look at this image. So here the small 1 to 2 mm. Okay, so small 1 to 2 mm white like it looks like a rashes. Okay, so but these are not rashes. Okay, so these are what we call so these are a melia. These are what we call the melia. Okay, so that's the very important multiple small white marks on the nose, cheeks and the forehead. So this is what you call as the melia. Okay, so this is what we call the melia. Very important for your exam. Okay, so hope it is clear, right? So the next question is here in front of you. At the what age does baby typically develop the social smile? This is your assignment question. Okay, so one more simple question is here. For this question, options are at the birth, at 2 weeks, at the 6 week to 8 weeks, and at the 6 month. Okay, so when does the baby will produces the social smile? So I want to answer for this question at the end of the video also. Yes, here also people are giving the correct answer and try to mention the answer at the end of the video also. Okay, here's the next question. At what age does stranger anxiety typically begins in the infants? Okay, so at the what age does the stranger anxiety will typically begins in the infants? Okay, so this is also your assignment question. Okay, yes, so option is 2 months, 4 months, 6 months and 1 year. So what is the correct answer? What is the correct answer? Just try to mention in the comment box at the end of the video. Okay, so here's the next question. Yes, according to the rule of 10, cleft lip surgery should be performed when the infant is option A 10-day old, option B 10 months old, option C 10 weeks old, and option D 10-year old. Sorry, 1 year old. So what is the correct answer? According to the rule of 10 in the cleft lip surgery, okay, so before performing the cheiloplasty, that is the repair of the lips of the babies. Okay, so that's the before performing the cheiloplasty. So we used to go for the roll up 10. Okay, if this roll up 10 is eligible, then only baby is eligible for the undergoing the surgery. Okay, so in case of the cheiloplasty, okay, cheiloplasty is the repairing of the lip of the baby. Okay, so what is the cleft lip? Cleft lip means if there is any gap between the formation of the lips during the birth. Okay, that is what we call the cleft lip. Okay, so this cleft lip surgery we also call as the cheilo, means a lip. Okay, plasty means repairing of the lip. Okay, very simple. Cheiloplasty is the a very important surgery we will do for the cleft lip patients. Okay, before doing this cheiloplasty, we have to assess for the roll up 10. Okay, so according to the roll up 10, yes, when the baby is eligible for the undergoing the surgery, yes, the baby should be more than 10 week of the age, and the very important, understand the roll up 10 here. Okay, very important. Take a screenshot and revise once after the class also. Okay, so that is the very important one. All right, so according to this one, like age should be more than 10 week of the age old, and the weight should be more than 10 pounds. Okay, and the hemoglobin should be more than 10 gram per deciliter. Okay, so age should be more than 10 week or behind the 10 weeks. Okay, and the weight should be more than 10 pounds, and the hemoglobin should be more than 10 gram per deciliter. Then only this particular baby is eligible for cheiloplasty. We call this one as the repair of the cleft lip. Okay, so that's the repair of the cleft lip. Very important. Keep in your mind. Okay, so the next question is here waiting for you all. So please try to understand the question, analyze the question, and give the best shot in the comment box. Yes, which sutures are primarily involved in the oxycephaly? So what is the oxycephaly? Oxycephaly is the premature closure of the one particular suture. Which suture is that one? Yes, important question. Which suture is primarily involved in the oxycephaly? Option is sagittal suture, option B coronal suture, option B metoapic suture, option D lambdoid suture. Yes, the premature closure of the which suture we call that one as in the oxycephaly. Beta, in the oxycephaly, O you are getting, right? So here the O we have, here the double O we have, right? So the premature closure of the coronal suture, we call this one as in the oxycephaly. We call this one as the oxycephaly. So this is what we call as the very important question for your exam, and here are the a premature closure of the sutures and how it looks like. Okay, so remember the coronal sutures are prematurely closed, means so it is the sutures are closing before the defined time. Okay, so premature closure of the our coronal suture we call it as the oxycephaly, and that time the baby's head looks like a tower shaped head. Okay, so tower shaped head of the baby will be seen in case of the oxycephaly. Very important, remember for your exam. And if the sagittal sutures are prematurely closed, means yes is there, yes is there, that is what we call the scapulocephaly. Okay, so scapulocephaly, sagittal suture yes is there, and the sagittal suture yes is there. Okay, so that is the sagittal suture scapulocephaly. If the sagittal suture is closing in advance or the premature closure of the sagittal suture, we call this one as in the scapulocephaly. We call this one as in the scapulocephaly. Okay, so very important, that is the head look long, narrow, and the board shaped head will be seen. Okay, if someone is asking the question, board shaped head will be seen in which particular disease condition? So board shaped head will be seen in case of this scapulocephaly. So this is your very important question for your exam. Right, the meiotic suture or the metopic suture or the frontal suture we can say. So if the frontal suture are prematurely closing, that is what we call the triangular shaped head. Okay, so then the lambdoid sutures are prematurely closing, means so that is what we call as the plagiocephaly. Okay, so it is premature closure of the frontal suture, the trigonocephaly, and the premature closure of the our lambdoid suture we call as the plagiocephaly. Okay, so in this plagiocephaly, the flattening of the back of the skulls will be there. The back of the skull is completely flat. Okay, so that is the very important, the simple and important question. Tower shaped head will be seen in case of the coronal suture, a premature closure, that is in the oxycephaly, and the boat shaped head will be seen in case of the our sagittal suture, premature closure, that is the scapocephaly, and the triangular shaped forehead and head will be seen in case of the our frontal suture or the metopic suture, advanced closure, that is the trigonocephaly, and very importantly plagiocephaly, that is the flat back of the head. Okay, so that is what you call the plagiocephaly. Okay, premature closure of the lambdoid suture. Okay, so very important for your exam. Okay, so this is the very important question for your exams, right? So the next question is here in front of you all, so please try to understand and give the best answer. So this is the update, you can say. Okay, so this is the update on the leprosy treatment, diagnosis and the treatment of the leprosy. This is the update on the diagnosis of the leprosy, update on the treatment of the leprosy. So this is the latest complete guidelines what I will teach to you people. Okay, so the new guidelines have been released by the WHO. Okay, on the April 1st 2025. Okay, so in the like we adopted that one in the National Leprosy Eradication Program. Okay, in the NLEP, so that is in the National Leprosy Eradication Program, we have adopted the a new regimen and the new diagnostic criteria which was given by the WHO. Okay, so India's revised multi-drug treatment regimen for the pescibacillary leprosy. Okay, so that is the multi-drug therapy we are using in the treatment of the leprosy treatments. Means if the fever coming, I am giving the paracetamol. So that is the monodrug therapy. Here the leprosy is coming means I am giving the 3 drugs together. So that is what we call the multi-drug therapy. Okay, so the multi-drug therapy includes the giving the 3 drugs for treating the one disease. Okay, so that's the multi-drug therapy, very important in case of the pescibacillary leprosy. Okay, so the leprosy have been diagnosed into 2 types of the leprosy. One is the multibacillary leprosy, another one is the pescibacillary leprosy. So I will discuss what is the multibacillary leprosy, what is the pescibacillary leprosy, and what is the new multi-drug therapy regimen which is came for the our treatment of the leprosy in the April 1, 2025. So that one also I will discuss in this particular video. Okay, don't have to worry. First we will see updates on the diagnostic criteria of the leprosy. Okay, so what are the updates are there in the diagnostic criteria of the leprosy? Students, understand. Here is the pescibacillary leprosy. When we will see the pescibacillary leprosy, when we will send the sample to the lab, there is no growth of the bacteria. Okay, so negative bacilli in the lab test. Okay, along with that, when we will check the nerve involvement, there is no any nerve involvement. Okay, so negative lab test, no nerve involvement, and 1 to 5 skin lesions are there. Okay, only 1 to 5 skin lesions are there, right? 1 to 5 skin lesion, no nerve involvement, negative lab test. So that is what you call the pescibacillary leprosy. Okay, the treatment of the duration of the treatment is only 6 months in this particular pescibacillary leprosy. That is the multi-drug therapy we are giving. Okay, there is the dapsone, rifampicin, and the one more thing, that is what you can clopazimine. Okay, so 3 drugs we are giving together. Okay, for the duration of the 6 months, right? So next comes to the multibacillary leprosy. That means the multibacillary leprosy, yes, the lab test will be positive. The positive bacilli in the laboratory test more than or equal to nerve involvement, more than one or one nerve involvement is there. Okay, and more than 5 skin lesions are there. More than 5 skin lesions, more than 1 nerve involvement, and the positive bacillary. So we call positive bacillary in the lab test. Okay, we call this one as the multibacillary leprosy. So in this multibacillary leprosy, the treatment duration should be 12 months. Again, we are giving the same drugs. There is the multi-drug therapy. Okay, so there is the dapsone, rifampicin, and the clopazimine. Okay, so comes to the dosing and the new treatment regimen of the leprosy. New treatment of leprosy in National Leprosy Eradication Program, which came on the 1st April 2025. Okay, so very important. India adapted this on the 1st April 2025. Okay, so here very importantly consider the pescibacillary. I told no nerve involvement, no positive lab test, only there is 1 to 5 scan lesions are there. So we call that one as the pescibacillary leprosy. Okay, in this one, if the patient is adult, same we will give the 6 month. If the patient is children, same we will give the 6 month. Okay, in the passive bacillary, the duration of the treatment is the 6 month, whether it may be adult, whether it may be children. Okay, so I told we are giving the multi-drug therapy. Which are the three drugs we will give? There is a dropson, the drug of choice for the leprosy, clopazimine, and the most effective drug for the leprosy, rifampicin. Okay, so these three drugs we are giving here. Okay, so in the adults, how much we are giving? 100 mg dapsone we are giving the daily, and half of that one, 50 mg dapsone we are giving to the children's daily. Okay, so clopazimine 300 mg once a month. Okay, in 1 month 300 mg once a month we are giving, and daily we are giving the 50 mg of the clopazimine. Okay, in the adults, same half of the that one 150 mg once a month we are giving, and the 50 mg every alternative day we are giving in the children's. Very important, right? So next, in the rifampicin, 600 mg once a month. Okay, and here's the 450 mg once a month. So this is the very important. Keep in your mind. Better rifampicin in the passive bacillary and in the multibacillary given only once in the month. Remember. Okay, it may be a passive bacillary, it may be a multibacillary, it may be adults, it may be a children's. So rifampicin drug will be given once in a 1 month. Okay, so that is the very important. Keep in your mind. Okay, so next comes to the multibacillary leprosy. In the multibacillary leprosy means there are the more than 5 skin lesions are there, more than 5 skin lesions. Along with that, there are the more than or 1 nerve involvement and the positive lab test. That is what you call the multibacillary leprosy. Okay, so here in this one, the duration I told, we have to give the treatment for the duration of the 12 months both in the children and the adults. Okay, so similarly same drugs, dapsone, clopazimine, rifampicin. Okay, so similarly same dose, 100 mg in the children's, dapsone, and the 50 mg in the 100 mg in the adults. For the dapsone, 100 mg in the adults and 50 mg dapsone in the children's. Very important. Then the 300 mg once a month clopazimine and the 50 mg daily clopazimine in the adults. Okay, similarly 150 mg of the once a month clopazimine and the 50 mg alternative day we are giving the same doses, so everything will be same. Okay, but the very important thing, the duration in the multibacillary TB will be 12 months of the treatment, and the duration in the passive bacillary TB is the like only for the duration of the 6 months. Okay, so this is a very important one you have to keep in your mind. So this is the completely updated treatment regimen or the new treatment regimen for the leprosy, what you have to keep in your mind now. Okay, so this is the very important one. And here is the next question, which is waiting for your brilliant and very brilliant answer. Yes. A newborn weighs 3 kg at birth. So at the birth, what is the weight of the newborn? At the birth, birth weight of the newborn is the 3 kg. And what would be the expected weight at the 5 months of this particular normal growth? Okay, so what would be the expected weight at the 5 months if the growth is normal? Okay, so every one of you know that at the 5 to 6 month the baby's weight will be get double. So apply the simple formula. The baby is the 3 kg. Okay, now it is 5 months. Okay, so that is the, I will make it double. Okay, sorry, 6 kg goes to the correct answer. Okay, very important. So keep in your mind. Sorry. Yes, keep in your mind this chart. Okay, so very important. What is the average birth weight of the Indian babies? If someone is asking, the Indian babies having the average birth weight of the 2.5 kg to 3 kg is the average birth weight of the Indian babies. Okay, if it is going less than 2.5 kg, we call that one as the low birth weight. Okay, very important. And here we have the 5 months, means the baby's birth weight will get doubles. Okay, a question will comes in your exam. When the birth weight of the baby will get double. When the birth weight of the baby will get double. So the birth weight of the baby will get double at the 5 months. Okay, if in range, if someone is asking, that's the 5 to 6 months will be the range of the answer. Okay, very important, right? Sir, in the both 5 months, 6 months, both are there in the option. What to do, sir? Choose the 5 months, sir. Okay, so the next one is the 12 months. In the 12 months, the baby's weight, weight will get triple. Okay, so that is the 3 kg, double is the 6. Okay, so 3 kg, triple is the 9. So in the 12 months, okay, so question will come at the 1 year of the age. What is the expected weight of the baby? Expected weight of the baby at the 1 year is the, yes, triple of the birth weight. Means the birth weight is 3 kg, means triple means that is the 9 kg will be the birth weight of the baby at the 1 year of the life. This is your examiner favorite question. Okay, this is your examiner favorite question. There is highest chance of asking and striking in your exams. Okay, so please keep in your mind. The next one is the 2 years of the life. Okay, so there is in the 12 kg. Okay, so the quadruple birth weight will be there at the 2 years of the life. Okay, so then very importantly, the next one is having the very least chance to ask in your exam. But just keep in your mind, at the 5 year, the weight will be near about 18 to 20 kg. It will be there. Okay, so just you have to remember, at the 6 month or the 5 6 months double, 1 year triple, 2 year quadruple. Okay, so this is the only you have to remember. Okay, so this will be a weight in the weight gain of newborn. Okay, how newborn will gain the weight. Okay, so this is the pattern of the weight gain in the newborn. Okay, here you have to remember one golden rule, that so that is after the birth. Okay, so 10% of the weight will get lost. Okay, and the 10th week onwards it will start to gain. Okay, so very important. So not 10th week, it is the 10th day. Okay, don't get confused. 10th week means it's over. Okay, so it is the 10th day. Okay, so 10% of the weight loss will be there in the first 10 days of the life. After 10 days, it will start to gain the weight, start to gain the weight. Okay, so that's the very important. Keep in your mind. Okay, so and few more single liners you have to keep in your mind. Okay, for the after 10th day, so after the 10th day it is started to gain the weight, means it will gain the weight for the, yes, any doubts? Yes. Okay, so after the 10th day, if it is started to gain the weight, means, so how much it will gain the weight? It will gain the weight of the 30 gram per day. Okay, weight will be gained for the duration of the first 3 months. Okay, for the first 3 months, 30 gram per day it will be gained for the first 3 months. Okay, after that, followed by the 400 gram, followed by 400 gram of the weight is gaining per month. Okay, for the duration of the 1 year. Okay, so that is the very important. Keep in your mind. This is how the pattern of the weight gain will happens in the newborns. Okay, so very important questions and the concept there is highest chance of asking and striking in your exams. Okay, so here is the next question. What is the average length of the full term newborn at the birth? So what is the average length of the full term newborn at the birth? I am 100% sure that every one of you will give the correct answer. Okay, so this is your again the 10-star question. You people have practiced this one multiple time in the test series. You people have revised this one multiple time in your notes. So that is the reason the every question which is coming in front of you are looking easy. So which is looking easy means you are about to get the selection. Okay, so that's it, right? So what is the average length of the full term newborn at the birth? The average length of the full term newborn at the birth is the 50 centimeters, the average length of the full term newborn at the birth. Okay, so this is the very important. Keep in your mind the 10-star important question. Okay, so how weight will be gained here? Okay, so do remember this note. Okay, so sorry, weight, not weight, it will be height gain. Okay, in the newborn, very important. So expected average weight at the birth is 50 centimeter. Okay, so baby will be born So now baby came out of the vaginal cavity. So what is the length of the baby? So length of the baby will be, expected weight at the birth will be 50 centimeters. So in the full term newborn, right? So at the 1 year, it becomes 75 centimeter. Okay, means 75 centimeter means it is added 25 centimeter gain. Okay, so 50 centimeter plus 25 centimeter means it will be 75 centimeter. Okay, so at the 1 year it is this 75 centimeter, means we can say 25 means half of the 50. We can say half of the 50 means 50% of the birth weight. Yes, so the question will come, the 25 centimeter gain in the first year or the 50% of the birth weight will be gained in the first year. So this is the your examiner favorite question. Okay, so 50% of the birth weight will be increased for the next 1 year. The birth height will be increased in the next 1 year. Okay, so at the 1 year of the age, so the baby's height will be 75 centimeter. Okay, so next at the fourth year only it is going to get double. Okay, so birth height is the 50 centimeter, and the now at the 4 year the height will be double. Okay, so that is the reason, very important, when the height of the newborn it will get double, the height of the newborn it will get double at the 4 year. Okay, so it will get double. Okay, approximately height will get double at the fourth year of the life. Okay, this is the very important question. So it is having the highest chance and striking in your exam. So this is your 5-star question. Okay, so don't forget this question. It is a very important one. Okay, so please keep in your mind. That is the height gain. Okay, so the next one. Yes. At what age does a child head circumference become equal to the chest circumference? At the what age does the child head circumference is equal to the chest circumference? Option A at the birth, option B at 3 months, option C at the 6 month, and option D at the 1 year. At what age does a child's head circumference is equal to the chest circumference? You know, at the birth, the head circumference will be 33 to 35 centimeter, and at the birth the chest circumference will be 31 to 33 centimeter. So these both become equal. That is 40 centimeter, or both become equal. You can say when it will get equal. It will get equal at the duration of the, or at the time of the, yes, of course, 100%. So that is all of your answer is correct. It will get equal at the 1 year of the life. Okay, at the 1 year of the life, both will get equal. Okay, so that's the very important one. The answer for this particular question goes to the, both are get equal at the 1 year of the life. Okay, so very important. The head circumference is equal to chest circumference will be seen in case in age at the age of the, that is our 1 year of the life. So this is the very important question for your exam. Okay, this is the very important question, which looks like easy, but it makes you confusion in the exam. So just I want to brush up your knowledge. Okay, already people have gone through this one. Just I am remembering you these all things. Okay, yes. The next question is here in front of you. Which instrument is used to measure the length of the infant below the 2 years of the life? Yes, which instrument we are using to measure the length of the infants below the 2 years of the life? Option A, studiometer. Option B, infantometer. Option C, weighing scale, and option D is the measuring tape. Measuring tape we are using to measure the head circumference, chest circumference, and waist hip ratio. We are using there the measuring tape. Okay, so measuring tape we can't measure the length of the or the height of the children's. Okay, yes, if you are using to measure the length, okay, so that will be measured in the supine position. Okay, so the infantometer will be used if the age group of the children is less than 2 year. Okay, so if the age group of the children is less than 2 year, okay, we will use the infantometer to check the length. Okay, okay, so if you are checking the height, if you are checking the height in a more than 2 year children, more than 2 year children, then we will use the studiometer. Okay, so these are the very important and the small things just you people have to remember. Okay, so this is the studiometer where we are using this one. Okay, so please keep in your mind these are the very important image based questions also. Okay, so then the answer for this one is the, if the child age is below the 2 years and we are checking the length, so we are using the infantometer. Okay, so that is the correct answer for this question. Okay, hope it is clear to every one of you. And what are the golden point discussion and the golden question discussion we have done today? There is highest chance of asking at least 1 or 2 question in your exams. Okay, so keep in your mind, keep preparing. Okay, be in a positive mindset. Okay, I already told you people, so if you are now in a positive mindset, means half of your work will be done before going to the exam only. Okay, so stay positive, keep your friends also positive, say some motivative words for your friends also, take help from your friends if any clarification required. If you still have the doubts, use our app chat box for asking the doubts. Okay, you will get the complete clarification there. Okay, so and if any one of you are preparing for the RRB also, SGPGI, KGMU also, okay, and any of your friends, if you want to refer, you can refer our master nursing class app here. So you are getting the everything, that is the classes plus test series plus notes plus subject wise test, that is everything which is required for the purpose of the all the competitive exams. Okay, so we are giving under the one roof. Okay, so all it includes the one course, all it includes the only one course. Okay, where you are getting the all the things. Okay, very importantly, we will launch within a 1 week, so it will be available for you all, so which focuses on the Norcet 10 and upcoming RRB exam. Along with this, it will focus on the SG, PGI exam and KGMU exam and any other MNC entrance exam. If you study one time from our batch, okay, you can crack any state and central government exam very clearly without having the single percentage doubt. Okay, so hope it is clear to every one of you. And so this particular course will be coming under the plan A. Okay, so that plan A will be visible on your app very soon, and the very soon. Just stay connected. Within a 1 week, you will get the fully fledged course for the complete practice and the victory way. Okay, so that is the promise from our side what we will give now. Okay, so thank you so much for watching the class till the end. And if anyone of you are still not a part of our WhatsApp group and Telegram group, you can join. The link is there in the description box, and download our Master Nursing Classes app for your better preparation and the better future. Thank you so much for watching the video till then. Bye bye. Take care. Love you all. Any doubts you people are having, means just try to comment in the comment box. Okay, so related to any nursing subject, if you have the doubts, just comment in the comment box. I will solve your answer or questions. Okay, so thank you so much for watching the video till then. Bye bye. Take care. Be positive and keep your friends also positive, and create the positive among others. Thank you so much. Bye bye. Take care.